Good morning to all. So today we are going to celebrate the World Asthma Day on the occasion of World Asthma Day conducted on May 7th. So herewith we are having the health talk. This session is going to lead by Dr. Badmasri, Assistant Professor. So herewith I am going to call upon to give the brief session on the World Asthma Day. Welcome you, Doctor.
Thank you, Doctor. Thank you for the introduction. I really thank JSS management for giving me this opportunity on this day, World Asthma. And this year, we have a theme that is making inhaled treatment accessible for all. So that is the theme of this year. And every year we are targeting to reduce the number of asthma patients over a particular area. We need to understand what is the purpose of celebrating this Asthma Day. Asthma Day is observed on the first Tuesday of May annually to raise the awareness and address the rising global impact of asthma. Asthma is one of the most prevalent chronic diseases among the children, and it is a non-communicable condition that actually affects everybody regardless of age. That can affect anyone regardless of age. World Asthma Day 2025 falls on May 6th. In recent year, that causes asthma and that have been speaked, and especially in the urban regions. It is observed that because of climatic challenges, an asthma becomes a chronic disease that is especially more higher in the recent years. And that says the World Asthma Day is celebrated on the that is organized by the Global Innovative for the Asthma, that is GINA, a World Health Organization that is founded in 1993, and the day is celebrated to raise the awareness of asthma worldwide. And today we are going to see about what is asthma and the symptoms of asthma, causes, diagnosis, treatment, and how to live with it. So this is the target we are going to learn today. And yes, what is asthma? It is very important. We need to know what is asthma. Asthma is a chronic lung disease characterized by the inflammation and narrowing of airways, making it difficult to breathe. This condition can cause symptoms like coughing, wheezing, shortness of breath, and chest tightness, which can range from mild to severe, come and over a time. So we need to understand the prevalence of asthma. Yes, the study estimates that 17.23 million asthma cases in India with 2.05 prevalence rate. The global burden of the disease from 1990 to 1919 reported that estimation of 34.3 million cases, making up 13.09% of the global asthma burden. And the asthma causes 13.2 deaths per 1,000 people in India. It contributes to 27.9% of the asthma related disabilities in the country. Overall, India has the third higher asthma related deaths over the 2 times higher disability that is from the global average. Yes, why it is matter, why it is more important to know about asthma, and we need to create the awareness. Yes, asthma is the most common chronic diseases in children, and it can affect anyone at any age, especially speaking on the urban areas. It says that urban people are having more chance to get affected by this asthma based on the report submitted today. That Times says that noticeably the temperature within the 24-hour cycle, especially on the urban areas, the phenomena is to known the urban heat island effect. The daytime temperature crosses more than 30 degrees Celsius, while the night cool downs rapidly. The people living in the city centers are often more affected by this comparatively to the suburban or greenery parts, especially on the village areas. So this says that according to the studies, the urban areas can be up to 5 to 7 degrees Celsius warmer than the surrounding temperature. So especially in India, it says it seems to be 45 to 60-degree reduction in urban green cover over the past 2 decades due to rapid development. This sharp and frequent temperature swings have direct impact on the human health, especially respiratory health. Although the body has the self-regulatory mechanism, they often can't be keep up to the abrupt changes. One on the other hand, the microorganism, especially the viruses, drive in the extreme conditions, and these activity increases the fluctuating climates. This results in more upper and lower respiratory tract infection, which in trigger asthma in many patients. The data suggests that the respiratory illness can rise up to 20% during the time of severe weather conditions, especially in the urban areas. Seeing the rise of asthma causes mainly due to the air pollution, extreme heat, and shifting of weather pattern. How the climate and asthma is related. An urban climate is changing versus the quality. The longer allergic seasons and higher level of pollutant, dust, and smoke. The children and elderly are more vulnerable. Asthma symptoms like wheezing, cough, breathlessness are being more severe and frequent. Yes, we need to understand who are at risk. As I told you before, it is more common in all aged things, like especially on the children's, elderly people, people with low immunity, existing asthma patient who is having the high risk of getting asthmas. Why the asthma is rising? Because of the urban air pollution, because of the extreme heat, because of frequent viral infections. These factors create a cycle and worsen the asthma symptoms and increases the hospital visit. So the recent study says that the change in climate and temperature is concerning for the people already living with asthma, and even more for the children and elderly, those who are with the weak immunity. So that says, based on the WHO estimates that around 15 to 20 million people in India are already suffering with asthma, and with urbanization of rising, these number could be expected to grow in the future. So we need to understand the common symptoms of asthma. Yes, the symptoms of asthma can vary person to person. The symptoms sometimes get slightly worsened, and this known for the asthma attack. Symptoms are often worse in the night comparing to the daytime, and also it is getting more worse when you are doing a vigorous exercises. So the common symptoms, general symptoms are said to be wheezing and breathlessness, excessive cough, tightening in the chest, and the symptoms of asthma attacks are especially said to be severe wheezing, breathlessness, fasting breath, fasting heartbeat, drowsiness, and blue lips. So the common symptoms of asthma can be vary person to person. So it is very important to diagnose the asthma at the early stage. Coming to the risk factor. So the risk factor says that already the developing asthma exposure throughout the patient's lifespan. So especially that includes in the prenatal period. Yes, the asthma begins early, even before the birth, the asthma can be detected. The risk factor for the asthma development encompass these exposure throughout the patient's lifespan, including the prenatal period. The most sustainable known risk is atopy, which is characterized by the genetic tendency to provide the specific immunoglobulin. So this antibody is responsible to cross the allergens. Nearly 1/3 of the children with atopy will develop the asthma in the later life. So we need to understand the factors that is behind the prenatal and perinatal changes that is causing the asthma in the future. So the prenatal and lung development is the most crucial period where the people can experience, that is preterm. Before 36 weeks, it is associated with the elevated risk of asthma throughout the childhood, adolescence, and adulthood. So the researchers are pointing out that the impairment of the lung development throughout the childhood, so that can also cause, without early respiratory complication, increases the long-term risk of asthma. Exposing to the maternal smoking is also the cause of adverse respiratory outcome that includes the premature delivery, further elevating the asthma risk. So the incidence of childhood asthma increases with the maternal age of 20 or younger. So that decreases the maternal age of 30 or more. So the maternal diet is said to be very, very important. So coming to the development of lung, so the primary, so preterm birth, that is below 36 weeks, is the major asthma risk factor, even without early lung problems, and impairs the lung development and increases the lifelong risk. So coming to the maternal smoking, so that is also a cause of asthma in the future. So the smoking during the pregnancy will lower the newborn lung functions, and that risk of childhood asthma, premature birth can also occur. So coming to the maternal age and the asthma risk, is below the age of 20 years, that has the high risk of asthma in the children, and above the age of 30 is having the lower risk of asthma. And coming to the maternal nutrition, which is also one of the major factors that can cause the asthma, is vitamin D deficiency impacts the immune cells and the fetal lung development. So the protective role in reducing the asthma, wheezing up to the age of 3. So the omega-3 fatty acid can also lower the risk of persistent wheezing. Vitamin C, vitamin E, and zinc potentially protective effect on the children. And vitamin C has the 28% of the wheezing supplemented group and 47% in non-supplemented group will be helpful in reducing the asthma level in the higher incidence. Yes, in childhood also we need to understand how much the asthma is getting affected. So the wheezing caused by the viral infection, especially of respiratory singing virus, the human rhinovirus may predispose the infants and the young children to develop the asthma later in the life. In addition, early life exposure to the air pollution, including the combustion of the byproduct from the gas fired appliances, and in indoor fires, obesity, and early puberty can also increases the risk of asthma in the childhood. Coming to the adulthood, the most significant and recent factor for adult onset asthma include tobacco smoke, occupational exposure, adult with the rhinitis and atopy. Studies also suggest that the modest in the asthma incidence among the postmenopausal women taking the hormone replacement therapy are also having the higher incidence of getting asthma. Yes, coming to the causes of asthma. So coming to causes of asthma, we need to understand the main factors that could be, so the exact cause of asthma is still unknown, but the research suggests that the following factors could be increases the chance of getting asthma, that is genetic, pollution, having an allergic related condition, childhood exposure to the tobacco. This could be the possible causes for the asthma. So the major factor has been linked with increasing the development of asthma, although it has been often difficult to find the single and direct contact. Yes, asthma is more likely in other family group like asthma, particularly in close relatives parents, or siblings. Asthma is more likely in people who have a allergic condition, especially like eczema or rhinitis. And urbanization is one of a associated factor that increases the asthma prevalence, probably due to the multiple lifestyle factors. Events in the early life factor that develops the lung and can increases the risk of asthma. This includes the low birth weight, prematurity, exposure of tobacco smoke, and other sources of air pollution, as well as viral respiratory infection can also cause the asthma. Exposure of a range of environment, allergens, or irritants are also thought to increases the risk of asthma, including indoor and outdoor air pollution, house dust, mites, molutes, and occupational exposure to the chemical or foams or dust can also cause the asthma. Children and adults who are having overweight, obese, are having the greater risk of getting asthma. Coming to the history and physical. So that is physical examination and history that suggests that the cause could be the asthma. So the general symptoms coming from the history, that exposure to the household triggers like dust, pets, cockroaches can cause the asthma. Work-related symptoms, family history of asthma, atopy, and past childhood wheezing or allergies. Coming to the physical examination, including to that, in history, it says that nighttime exacerbation of the symptoms or onset on the trigger of exercises, cold air, allergens exposure can also suggest the asthma. In contrast to the dyspnea, which can be the manifesting shortly after being exposed and resolves within 5 minutes of cessation of exercises, that could induces the symptoms of asthma typically emerges and 15 minutes into an activity, 30 to 60 minutes afterwards, the patient may also have the history of same with the eczema and the hay fever. Coming to the physical examination, during the physical examination, the widespread high-pitched wheezing are characterized finding associated with the asthma. So the pale nasal mucosa, nasal polyps are asked to be checked immediately. So that suggests that the wheezing is not specific to the asthma. It is typically absent between the exacerbation. The findings suggestive of the severe asthma exacerbation includes dycardia or prolonged expiratory pace, reducing the air movement and difficulty in speaking, and that gives the discomfort when lying supine due to the breathlessness and adopting of the tripod position. This use of this lying in supine, we can understand the accessory muscles of respiratory during the inspiration, and pulses peroxidized with an additional indicator of the severe asthma. Yes, we need to understand the diagnosing part of the asthma, how we will understand whether the person is having asthma or not. For that, the general doctor usually able to diagnose the asthma, or they may refer you to a specialist for analyzing the asthma. The following test can be carried out to the diagnosing of the asthma, that is spirometry, peak flow meter, and some test. So in detail, we'll see about the spirometry. So spirometry assesses the force expiratory volume in 1 second and force vital capacity. So for asthma pattern, the obstructive, that is, it measures the maximal inhalation followed by rapid and forceful exhalation into the spirometer. So the asthma typically presents as an obstructive pattern on spirometry that indicates the reduction of FEV1 or to FVC ratio. So additionally, the visual examination of the expiratory flow volume loops can reveal the obstructive pattern. So the looped, so the flow volume loop will be having the concave expiratory portion that indicates asthma, and the bronchodilator response, like administrating of 2 to 4 puffs of these spirometry will increases up to the level of 10% in the flow volume loop. So that can indicate the bronchodilator, and the normal result can occur in the asymptomatic individuals or cough variant asthma. So the false negative may occur in the chronic medication in the minimal symptoms in the recent bronchodilators. And coming to the next, it is bronchoprovocation test. So this test has to be done during to include the bronchial constriction during the inhalation. So the purpose of this test is to induce the bronchoconstriction using a mannitol, exercise, and hyperventilation. So this test is incremental. So the doses followed by the spirometer, this broncho provocation test will be done. So the positive test will be indicating the FE1 drop that is less than 20% with the metacolin and more than 15% with the saline. So can also use the exercise and aspirin and environmental trigger for testing this. And another major thing is peak flow meter. So peak flow meter purpose is to monitor the asthma severity, not for the initial diagnosis. So the procedure will be carried by minimal breath followed by the forceful exhalation for 1 to 2 minutes. So the measurement will be highest of 3 attempts. So depend upon the patient's efforts, we'll be calculating the severity of the asthma. So the limitation of this peak flow meter is to reduce the peak flow is not specific for the asthma, can occur in any condition. So next is exhale nitric oxide. So that is also one of the major diagnostic tool that is mainly to find the inflammatory causes in the upregulation of the nitric oxide synthesis in the respiratory mucosa leading to the elevated nitric oxide. So the purpose is to elevate the nitric oxide level indicating the eosinophilic airway inflammation. So this diagnoses the asthma. And next is pulse oximeter, which is also an important diagnostic tool that helps in accessing the severity of the asthma attack or monitoring the deterioration. For the main use of this pulse oximeter to assess the asthma attack severity. So the limitation is declining the oxygen levels may indicate a late stage or worsen condition. And coming to the laboratory test, we need to go for the laboratory test, that is complete blood count that evaluate the eosinophilic level and asthma. So the elevation of eosinophils indicates the conditions like parasitic infection, allergic bronchopulmonary diseases, and alpha-1 antitrypsin deficiency. The test is non-smokers with irreversible airway obstruction. Allergic test may also helpful for the identifying the significant trigger in the persistent asthma. And from imaging, we can identify the chest radiographs in the asthma patients are often normal. However, during the acute exacerbation, so the abnormal findings such as hyperinflation, bronchial thickening may also be observed. In chest X-ray may show the hyperinflation, bronchial thickening during the exacerbation, and high resolution of CT exposes the abnormalities on the X-rays, or if there is any condition is suspected. So additional indication for the chest radiography includes the patient experiencing symptoms that are difficult to control, fever, chronic purulent sputum production, persistent localized wheezing, hemoptysis, weight loss, clubbing, and inspiratory clucks, hypoxia, and moderate severe airflow obstruction can also cause the bronchodilation. Yes, coming to the treatment part. So coming to treatment, generally we use inhaler that prevents and relieve the combination in inhaler, and some tablets and drugs can help in reducing, and injection can also be taken only with the prescription of the specialist, and complementary therapies like breathing exercise and relaxation technique can also helpful in reducing the asthma. So treating asthma, we need to see the first thing, that is patient education. So educate the patient is very important. So the personalized education for the patient's primary clinical is to reduce the asthma exacerbation and the hospitalization. So the key thing is we need to educate the patient that the understanding of asthma, recognizing the asthma symptoms and the triggers. So the inhaler can be used for the proper technique for the inhaler usage and the medication adherence. So the medication differentiate between the rescue medication and the long-term control medication. Action plan. So the personalized action plan to manage those symptoms should be so should be educated for the patient. So we need to understand the zones in action plan. The green zone said to be the peak flow meter more than or equal to 80% of the personal best, no symptoms. So next is yellow zone. So the peak flow meter 50% to 79%. So the symptoms like cough, wheezing and shortness of breathing will be there. And the next is red zone. So the peak flow will be less than 50% and severe shortness of breath, unable to perform the daily activities will be there. So based on this green zone, yellow zone and red zone, you have to evaluate the patient and you need to give the education properly. And next is based on asthma severity, you need to give the advice for the patient. So the severity determination based on the frequency and the severity of the symptoms, lung function, risk of future exertion, risk factor, frequent symptoms, history of ICU admission, poor medication, adherence, obesity, chronic rhinosinusitis. All these can cause the risk factor. And for severe asthma, we need to give the treatment approach in the stepwise based on the highest severity level. So the bronchodilator, the rapid action bronchodilator or low dose will be helpful, will be given as an inhaler in the asthma severity cases, and stepwise treatment should be given. The severity category guidelines based on the global guidelines will be helpful in giving the severity category guidance, treatment prognosis. Based on the severity of the asthma, we need to select which step of treatment should be given. The steps are divided into 5. So in that, if the case is very severe, we have to take the step 4 therapy. So the adding of long-lasting muscarine antagonist, that is the drug combination that can be given as inhalation, so considered as biological therapy, will be given in the step 4 therapy. So carried to that, the biological therapies, the following drugs can be given in addition for the severe cases of asthma. And other drugs can also be suggested for the immediate recovery from the asthma, including the discharge instructions that can be given to the patient, that review inhaler use, asthma action plan, and trigger avoidance should be teached before the patient get discharged, advance control and medication by one step, and ensure the medication adherence for the patient. And followed by that, we need to understand the asthma prognosis. So the influencing factor, interplay with the genetic, environmental, social determination of the health, poor housing, pollution, and low socio-economic status will worsen the outcome. And the prognosis, racial and ethnic minorities and individuals below the poverty line faces higher morbidity, and more visits of the hospitalization increases the mortality, and limited healthcare access can worsen the prognosis. Following with that, the global and clinical prognosis indicator, the international mortality up to 0.86 death per 1 lakh people lowers the lung function, strongly correlates with the increasing the mortality, 8% higher mortality with the lower 25% of the lung function. So the poor prognosis risk factor, age more than 40 years, pack the year smoking history, blood eosinophil has also have the poor prognosis risk factor. Coming to the complication, what could be the possible complications of asthma is mainly related to the disease complicated adverse effect of the drugs taken to control the asthma. The following list can contain the complication associated with the asthma, that is declining in the lung function, osteoporosis, fracture, infection, adrenal suppression, hypertension, diabetes, cataract, peptic ulcer, sleep disorder, obstructive sleep apnea, mood disorder, cardiac arrest, glaucoma, respiratory failure or arrest, aspiration. These are the possible complications that can lead after getting asthma. Coming to naturopathic treatment for the asthma. Yes, naturopathy can limit the level of asthma based on the stage of asthma. So coming to the diet therapy, it is very important to take the green leafy vegetables that is rich in antioxidants, citric fruits that is rich in vitamin C that boosts the immunity. Next is garlic that can be act as a natural bronchodilator. Omega-3 fatty acid can be taken through the source of flax seeds, walnut and chia seeds. It is very important to avoid all dairy products that can thick the mucus, and also it is important to avoid the fried and processed fruit that can also trigger the inflammation. Cold beverages and ice creams can act as an bronchial irritation, and it is also very important to avoid the sugar and refined carbs that can increases the systemic inflammation. Coming to hydrotherapy, to improve the circulation, to reduce the chest congestion and to calm the nervous system, we have to take hydrotherapy treatment. Hot foot bath is very much helpful in drawing the blood flow away from the lungs, relieving the bronchial congestion. Chest compresses can also be helpful, especially with the cold compress can reduce the risk of acute attack, reduce the inflammation and bronchial spasm. Neutral compresses can also be given to the chest, which calms the system and helps with the chronic symptoms. Steam inhalation with eucalyptus oil can clear the mucus and open airways. Coming to mud therapy is mainly given for the detoxification and reducing the inflammation. Chest mud pack is applied for 20 to 30 minutes to reduce the bronchial infection. Abdominal mud pack is aided to digestive and increasing the bloating, indirectly supporting the respiratory health. And coming to massage therapy. So the gentle massage along with the back, chest and shoulder promotes the relaxation and helps in reducing the muscle tension, improving the blood and lymphatic circulation, aiding in the respiratory function. And detoxification is the most important thing for the asthma. So intermittent fasting or fruit only diet helps in reducing the toxin loaded. And enemas or colon hydrotherapy may be recommended for cleansing under the supervision. So main goal is to eliminate the toxin that mainly aggravates the asthma. Coming to yoga therapy, pranayama, breathing exercise, improve the lung capacity, regulates the breathing and calms the nervous system, especially Anulom Vilom, alternate nostril breathing, balance the oxygen intake and reduces the anxiety. Brahmari pranayama, humming deep breath, will reduce and smoothens the vibration that relaxes the bronchial muscle. Kapalbhati will be beneficial in mild cause of clear mucus. Ujjayi pranayama will be helpful in strengthening the lungs and soothes the mind. And these are the some asanas and benefits. Coming to Bhujangasana, that opens the chest and lungs, that stimulates the adrenal gland. Dhanurasana will enhance the flexibility of the lungs and diaphragm. Achyasana will stretches the chest and improve the breathing. Sedu Bandhasana will helps in expanding the thoracic cavity and calms down the nervous system. Majjari Asana, so that it helps in improving the spine flexibility and respiratory rhythm. And last is Adho Mukta Savasana, so that will be helping in strengthening the respiratory muscles. So coming to meditation and relaxation technique, the mindfulness meditation reduces the emotional trigger like stress and anxiety. Yoga Nidra will helping in guided deep relaxation technique beneficial for the asthma sufferers, and progressive muscle relaxation that will help in reducing the physical and emotional tension that can trigger the asthma. Coming to lifestyle and environmental modification, it is very important to keep indoor air clean, use the filters, avoid smoke, strong perfumes should be avoided, practice yoga in clean and well ventilated area, avoid exposure to known allergens, and maintain a regular routine and avoid late night and heavy meal. Wear warm clothes to avoid the cold induced asthma. Precautions. It is always important to consult a healthcare professional before changing your treatment. Avoid vigorous breathing or asanas during an acute attack. Ensure the practice are supervised if you are the beginner or if you are having the severe asthma conditions. So it is very important to get the specialized doctor's advice before taking any kind of treatment. So living with asthma, be consistent with the treatment, always have regular checkup, have a flu vaccine, vaccinated regularly, keep a healthy lifestyle. All these could be helpful in living with asthma. All these suggestions will be helpful for an asthma patient, but still it is more important to consult a doctor before getting a treatment or before starting your treatment. So I am really happy and very much thank you for the JSS management, and also I recommend all the all the viewers who are watching this video to visit JSS Nature Cure and Yoga Hospital at Coimbatore, and I have given the dialing number that will be helpful for you to begin the treatment. All these treatments are just for your information. The major treatment should be started only with the advice of a proper physician. Thank you all.
Thank you, Doctor. On behalf of JSS INYS, I would like to extend my sincere gratitude to all of you to joining with us today for this insightful event. Special thanks to our esteemed speaker, Dr. Padmasri, for enlightening speech. Thank you all. So we'll meet with another health talk very soon. Thank you.